Actually, we also completed our 2 years in this new premises. On behalf of Team Maheshwari, I want to thanks each and everyone who have contributed for the development of the Maheshwari Hospital. Uh, for this, we wanted to conduct a CMEs and the workshop. So, based on that, today we have conducted this one CMA. Three speakers are there. So, let me introduce Dr. Poornima Kathari, madam. Uh, Dr. Poornima Kathari, madam, is properly from Koppal of Karnataka, and she did her UG from the Raichur Institute of Medical Sciences and post graduation from Vijayanagar Institute of Medical Sciences, Ballari. Uh, she had various practical experience in management of various trauma cases and emergency surgeries related to ENT. And she had assisted in various surgical procedures and also performed procedures independently. Currently, she is working in Kathari Hospital, and we welcome you all, madam. And I hand over the mic to you for the next.
Good evening, everyone. I'm Dr. Poornima Raghavendra Kathari, working as ENT consultant at Kathari Nursing Home and Multi-Speciality Hospital, Ilkal. And my topic is common ENT diseases. Content is we will content of the presentation include introduction, common ENT diseases in ear, chronic otitis media, cholesteatoma, BPPV, acute otitis media, hearing loss, and in nose it includes allergic rhinitis, deviated nasal septum, nasal polyposis, chronic rhinosinusitis, and epistaxis. And in throat it includes acute pharyngitis, chronic tonsillitis, and we will discuss regarding foreign bodies in ear, nose, and throat, and ENT facilities at Katare Nursing Home. First, we will discuss regarding what is ENT. ENT is a medical field addressing ear, nose, throat, and related head and neck conditions, and offering both medical and surgical treatment for these disorders. And different type of specialization of ENT are in ear includes otology, neuro-otology, nose rhinology, throat laryngology, head and neck and thyroid, facial plastic reconstructive surgery, and pediatric ENT. The most common diseases in ear, which includes CSOM, which I have observed in during this last 1 month. In chronic otitis media, the patients presents with complaints of chronic ear discharge and hard of hearing. When patient comes with hard of hearing, we should evaluate thoroughly. First, we should take history properly and duration of complaints of the patient, and then we should go for examination. During examination, we will do otoscopic examination when we should examine the external auditory canal. In that, mucopurulent discharge will be there. First, we should clean the discharge. Then we should examine the tympanic membrane. Tympanic membrane shows the perforation that will indicate the chronic otitis media, and we can do the examination under microscope also. Then we can send the patient for HRCT temporal bone. In temporal bone, we can see the ossicular status, and if any soft tissue present in mastoid cavity and middle ear, we can see. Then we should give the first we should give medical line of management. In that, we should give topical ear drops and oral antibiotics to discharge to reduce the discharge. Then later we should plan for surgery. When the ear is free of discharge for minimum of 6 weeks, then we can plan for tympanoplasty and mastodectomy. Tympanoplasty is the procedure to repair the tympanic membrane, and mastodectomy is the clearance of diseased air cells. Then we can see the cholesteatoma. Here patient will come with scanty ear discharge and blood stained discharge, foul smelling ear discharge. Here also we will do the mastodectomy and tympanoplasty. Acute otitis media. In this, patients will present. This is most commonly seen in the pediatric patient, which is due to the eustachian tube dysfunction. Here we will this one we will treat by giving nasal decongestants and antibiotics. Benign paroxysmal positional vertigo. In this patient presents with vertigo which is of less than 1 minute. 1 minute. This will be treated by the this will be diagnosed by Dixalpic manual, and we can advise the vestibular rehabilitation exercises and tablet Vertin we can give. And hearing loss will be conductive hearing loss, and it may be sensorineural hearing loss. It can be treated by the giving hearing aid trials. And in related to nose, the most common disease which is seen is allergic rhinitis, which I have observed during this last 1 month, which is due to the any allergen exposure. When patient here patient will come with complaints of nasal discharge, nasal obstruction, um, headache and a cold and excessive sneezing. Uh, in this case, we should ask the proper history and we should examine. In examination, we should do the anterior rhinoscopic examination. In that case, in allergic rhinitis, patient will be having pale mucosa over the septum and inferior turbinates. These are the inferior turbinates which are pale in color. Then this will be treated by medical line of management by giving antihistamines like cetirizine, avastin, and fexofenadine. And we can give a steroidal spray like mometasone nasal spray and fluticasone nasal spray. And other conditions we'll see is DNS, deviated nasal septum. Here we this one will be treated by surgical procedures like septoplasty. Then nasal polyposis. Nasal polyposis, these are two types, ethmoidal polyp and antroconal polyp. Ethmoidal polyps are allergic in nature, and antroconal polyps are infective in nature. These are treated by polypectomy and functional endoscopic sinus surgery. Then chronic rhinosinusitis, it is the inflammation of sinuses. This can be treated by functional endoscopic sinus surgery. And epistaxis is the bleeding from the nasal cavity. And here 2 days on 26th, I have seen one case of the 10-year-old male patient with complaints of left nasal cavity bleeding, and I have done nasal packing by putting nasal decongestant for 2 or 3 minutes, but bleeding didn't stop. So I have done anterior nasal packing. Packing was kept for 48 hours, and after 48 hours it has removed and bleeding has stopped and patient has been discharged. And in related to throat, the most common disease which I have seen in hospital is in this last 1 month is acute pharyngitis. Most of the people came with complaints of throat pain and fever, cold, cough, and it has when on examination, oropharynx showed the congestion of the posterior pharyngeal wall, and it is treated by oral antibiotics and betadine mouth gargle. And chronic tonsillitis, it can be treated by antibiotics, and later tonsillectomy has to be done. And we will discuss regarding foreign bodies in ear, nose, throat. um, the foreign bodies, here it shows the foreign body at the level of the upper esophagus. Coin which is present at the upper esophagus, it has to be removed by the emergency esophagoscopy, and foreign body removal with the help of forceps. And these are some foreign bodies which I have removed in the hospital. The one patient who came with garlic clove, which was present in the left ear, and it is removed with by the syringing. And groundnut seed which was present in the right nostril, and it is removed with the help of eustachian tube catheter. And one patient came with eraser piece from in the right ear, and it is removed by the syringing. This image shows the eustachian tube catheter, which is used for the removal of the foreign body from the nose. And ear syringing, It is used for the removal of foreign bodies from the ear. And ENT facilities, ENT facilities at the Kathari Nursing Home and Multi-Specialty Hospital, OPDs, IPDs, and surgeries. Regarding surgery, I'll discuss in next slide. And foreign body removal removal from ear, nose, throat, and emergency services around the day, around the clock. In surgeries, the facilities available are mastectomy, which is it is done for the chronic otitis media, tympanoplasty for chronic otitis media, and keloid excision, um, earlobe repair done for the earlobe tears, and preauricular sinus excision done for preauricular sinus, and nose polypectomy for ethmoidal and endocrine polyp, septal hemangioma excision, which will be arising from cartilaginous bony parts of the septum, and septoplasty for the deviated nasal septum, endoscopic sinus surgery for polyps and chronic rhinosinusitis, throat related surgeries like adenotonsillectomy, tonsillectomy for chronic tonsillitis, peritonsillar abscess drainage, and mucus retention cyst excision. In larynx, microlaryngeal surgeries, and in head and neck, thyroidectomy and biopsy from proliferative growth over the oral cavity, tongue, and buccal mucosa. Thank you.